Thank you for coming along tonight. Just to let you know that this webinar is being recorded so we can stick it on the Scottish Athletics webpage and share with other people. The webinar is on exertional heat stroke, and today presenting it is Dr. Cian McGinlay, who is a performance physiologist with the Institute of Sport. He works with elite athletes in their testing and providing advice on performance in various environmental conditions. So he's very experienced in this field. And although he works for the Scottish Institute of Sport or Sport Scotland, the content is his personal opinion, and the guidelines and protocols should in future come from the national associations. And also speaking is Gregor Nicholson, who is from the Moorfoot Runners and organises the Cadmiel roller coaster, where several juniors suffered from heat stroke a few years ago, and he's going to give a wee talk about his experience. Are you happy to go on now? Yeah.
Yeah, I'll share my screen now, Angela. If you can just confirm that I've shared it all right. Should be coming up now.
Yep, that's fine.
Brilliant. Hi everyone, and thanks for coming along this evening. And thanks for that welcome and the invite to present today, Angela. As Angela suggested, most of my work has been with elite athletes and preparing them for competing in hot environments, such as the last two Olympics and probably every Olympics from now on, thanks to climate change. So a lot of my experience is in heat acclimation or other measures to prepare athletes from competing in the heat. This is a slightly bit different to what I would normally prepare for. So it's quite an interesting topic for me to cover, because we would normally train athletes to avoid this, but in some cases it's unavoidable. What I'll look to cover today, so for anyone that needs to leave early, these are basically the fundamental points I would like you to take home from today's presentation. And the first one is that exertional heat stroke is the most severe form of exertional heat illness. And I'm going to talk about exertional heat stroke rather than the more classic heat stroke that the young or the elderly will experience, for example, in heat waves. Although I would suggest that if you're risk assessing as a race organizer, that your spectators will fall into that bracket of classic heat stroke. So it's probably something you might want to factor in, though I won't cover it today. Exertional heat stroke is a medical emergency. It's life-threatening. If you don't get cool within half an hour, you could suffer. Worst case, you will die. Potentially, you will need organ transplant. So it is something that needs to be treated seriously, but with adequate preparation and, importantly, with rapid recognition, it's highly treatable. And some researchers and experts in the field would say it's 100% treatable medical condition. The simplest way to reduce the risk is adjust the start time, adjust the race duration, or if conditions are going to be so severe that you might want to consider cancelling a race. So although there is some responsibility on athletes to prepare accordingly and to judge their pace appropriate to the condition, the most effect that anyone can have is the race organisers or the national associations on this, because they can reduce the risk for everyone in the race rather than the individual focusing on themselves. One of the points I'd like to make today is on heat index, which is a useful but very limited measure of assessing what the conditions are going to be like. And in terms of cooling, one of the key principles in treating heat stroke is cool first, transport second. And what that means is, if you suspect as a first aider or whoever is the first person to come across as an athlete suffering heat stroke, if you suspect heat stroke, you cool them. You don't try and bring them down the mountain. You don't wait for an ambulance. You cool them first, and then you may call 999 or you may seek further help. But cooling first is the principle. And now this I will go over the different types of cooling. The gold standard is whole body ice water immersion, which won't be pragmatic up a mountain. Maybe at the start and finish line, it's something you could have in a tent. But I'll just break it down of this gold standard and then kind of working your way down what other options are available. And the final thing as well for a runner, the simplest way to avoid heat stroke is, well, first, it's not to participate, but if you are participating, it's to slow down because you, as an athlete, are the primary source of heat. The conditions will dictate how quickly or how well you will cool down, but it's you and your intensity that dictate how quickly you're generating heat. So, in terms of regulating body temperature, you are the source of heat. So, your food energy, about 75% of that is lost as heat. It isn't used for work in terms of propelling you, in terms of moving you up a race. It's generated heat. So you are a major source of heat as soon as you start running. And the faster you go, you generate more heat. The greater the intensity, the greater the heat you are generating as a mammal. Um, Sweating doesn't cool you down. The evaporation of sweat is what cools you down. So as humidity gets higher, as the water content of the air surrounding your body increases, the capacity of that air to evaporate sweat from you is reduced. So when you get to, and if anyone's been in really, really humid, sticky conditions overseas in tropical areas, you sweat a lot, but it pours off you. It doesn't evaporate, so it has no cooling effect. So in the extreme, pushing 90 to 100%, you lose any cooling effect from sweat. So that's why humidity is such a huge effect on perceived temperature, because you aren't cooling as well as you would in low humidity. And one of the things that a lot of the heat measures, such as heat index, fail to take into account, and anyone who's run up a mountain or just run outside will know, is the heat from solar radiation adds more than the simple ambient temperature is telling you. So solar heat adds quite a bit. And again, things like heat index do not take this into account. In terms of core body temperature, so there isn't one core body temperature because it's going to be vary across different parts of the body. But just the concept of core body temperature is your central body temperature. The temperature of blood being ejected from your heart into your arteries. The normal core body temperature is about 36 to 37.5 degrees. It drops at night, so by about 4 or 5 in the morning, you're at your lowest core body temperature, about 36 degrees, and then it will rise throughout the day to about low 37s, up to kind of mid 37s, depending on the conditions. So, your core body temperature is variable throughout a day. And if you're exercising, that can push up to 39 degrees quite normally, quite tolerably. And if you're an elite athlete, if you're running a marathon in really hot conditions, you'll be pushing 40 degrees and you'll be able to tolerate it. You'll be fatigued, but upwards of 40 degrees in somebody who's highly drained isn't unusual. But we're talking about the context of exercise, of course. So if you've got a fever and you're 39, 40 degrees lying in your bed, of course, that's more serious than if you're running and you've got the same temperature. So when we talk about heat illness, heat exhaustion is pushing from sort of 38.5 degrees to 39.5 degrees. It's quite vague in terms of where it would start and end, but roughly about 38.5 degrees. And heat stroke, which is the most severe form of heat illness, is typically considered above 40.5 degrees. Some would say it's 40 degrees, and there's a little bit of uncertainty, but most people would say above 40.5 degrees. So that hyperthermia, that excess heat storage, is basically anywhere from 38.5 all the way up to some people report 43 plus degrees in severe heat illness. So you can gather from that heat illness is a range of different things. And today I'm going to focus on heat stroke, a little bit on heat exhaustion. But in terms of the risk of something occurring, which I've got on the horizontal axis here, and the severity of outcome, heat stroke has relatively low risk of occurring. It's not zero. Maybe it's, if you look at the Great Northern Run, it's maybe 1 in 1,000 on the warmer days. So it's quite a reasonable occurrence, but relative to heat rash or sunburn, it's relatively rare. But the severity can be catastrophic, whereas the severity of something like sunburn or heat rash is typically fairly mild. Exercise-induced muscle cramp, dehydration, they're fairly common, but relatively minor. I mean, you can get very severe illness from dehydration, but compared to heat stroke, it wouldn't be considered as severe. I won't go into it as much today, but hyponatremia can also be quite catastrophic, and it's almost the opposite of dehydration, where you've overdrunk. You've taken in too much water, you've diluted your blood so that it's drawing electrolyte out of the muscle cells, and that can be potentially fatal. So that's why that's in the rare but potentially catastrophic. And when you're in the field without proper diagnosis, you are essentially going to treat heat stroke and heat exhaustion the same, which is cool first, transport second, until there's some kind of medical diagnosis, until temperature has been taken by qualified medical personnel, because the only way to get accurate temperature really is a rectal thermometer. Any of the other surface skin temperature, ear temperature, anything like that isn't accurate enough to diagnose heat stroke. So heat stroke, it can be catastrophic, absolutely. It's one of the top 3 causes of death in sport across the world. And it can occur in mild climates, which will seem fairly obvious now. I've told you, you are the primary source of heat if you're an athlete running. So if you run hard enough, you can heat up in relatively mild conditions. But of course, the warmer conditions are going to increase the occurrence of heat stroke. But it can be 100% survival. So as long as these kind of principles are followed in that rapid recognition. So, for example, there's a brief given to all athletes at the start of a race, watch out for your fellow competitors, watch out for these kind of symptoms. So rapid recognition of the symptoms, rapid assessment by, whoever the first aider is, and then of course, rapid cooling. So that cool first, transport second, and get some medical support as soon as possible then. But yeah, those 4 steps: rapid recognition, rapid assessment, rapid cooling, and then rapid advanced care, the way you should be looking at heat stroke. So as I mentioned, to define heat stroke, it's during exertion. So exertional heat stroke during exertion, distinct from classic heat stroke in the elderly young. Body temperature greater than 40.5, although having a body temperature, core body temperature of 40 degrees wouldn't mean it's ruled out. If a first aider comes along, potentially someone's core temperature hasn't risen enough, or they've had a kind of spontaneous reduction in core temperature. So it's one of the criteria, but it's not always present. But what does tend to be present, and was the primary symptoms, is that kind of cognitive dysfunction. So collapse, altered consciousness, aggressiveness, confusion, irrational behavior, behaviors that are out of the norm for that person would be considered a primary symptom for exertional heat stroke. And as I mentioned, it occurs more in warmer environments, but can occur in cold conditions if the person is running hard enough or fast enough, or if there's impaired heat removal for some reason. For example, you've worn too much clothing or inadequate clothing, or you've some illness, or you take some medication that predisposes you to greater likelihood of heat stroke. Potential outcome if not treated, and we're talking about not treated within 30 minutes of getting extreme hypothermia, is increased organ damage. So you would need organ transplant potentially, and of course death. So that would be cool first, transport second. That would be the whole principle there, because 30 minutes of a core body temperature above a certain critical point will potentially be fatal. And it's that time above a critical temperature that's important. It's not the absolute temperature that somebody reaches. It's how long above a critical temperature before we've managed to cool them have they been. And that's the thing that's going to dictate the outcome. One thing I want to focus in on here as a primary symptom is cognitive dysfunction. So that collapse, aggressiveness, confusion. And the point I want to make on this is, when you look at some of the risk assessments, or you look at some of the advice on this, there's some onus on the athlete to recognize heat stroke symptoms in themselves. But when you see that that's a primary symptom, is that cognitive dysfunction. If an athlete is suffering heat stroke, cognitive dysfunction is going to mean they don't know they're suffering heat stroke. So the responsibility would then fall on first aiders, spectators, competitors, to recognize it in your fellow competitors, because the athlete won't know when to stop. And the athlete stopping will, when they're at the heat exhaustion stage, would be very helpful for them having a positive outcome. But they're going to continue. If they have heat stroke, they're going to continue until they fall over. So just to re-emphasize some of the symptoms, so that core temperature, cognitive dysfunction, other symptoms which are normally present, but would need to be diagnosed by a first aider: low blood pressure, high heart rate. And classic presentation of exertional heat stroke would be hot and wet skin, but that isn't always present, and that'd be different to the kind of classic heat stroke in the elderly or the young, where the skin is considered dry. And symptoms that an athlete would be experiencing would be dizziness, headache, rapid breathing, nausea, diarrhea. Some or all of these could be present. But a common misconception with exertional heat stroke is that somebody will have stopped sweating, they'll have hot skin, or they'll always be unconscious. That's not necessarily the case, and there's a phenomenon known as kind of temporary lucidity, where somebody may collapse but come around, and it would seem okay, actually they've come back to normal, but actually it's just part of the presentation of exertional heat stroke, is that you do get these moments potentially of lucidity. So while some of these symptoms might be present often, they're not always present. That wouldn't be a reason to rule out heat stroke. But just to cover off some of the risk factors, so obviously there's different external or internal risk factors, but one of the primary internal risk factor, and it's maybe something that could be considered in whether somebody participates or not, is if you've had a recent or current infection. So if you've had a fever in the past few days due to a viral or bacterial infection, that could predispose you to exertional heat stroke. And it's something that's been reported in the literature when they look at athletes or military personnel who have suffered exertional heat stroke. Quite often the person will report having a recent illness. And a second risk factor is, funnily enough, it's over-motivation. And a lot of this goes into the research done in military, where the exertional heat stroke is quite common in young recruits, young recent recruits going through the fitness part of their training, where they're highly motivated, quite like an athlete's going to be highly motivated, they want to do their best, but the effort you put in doesn't necessarily match your fitness, or isn't appropriate for the conditions you're exercising in. If you have low endurance capacity, you're going to be less able to tolerate heat than a fitter athlete. So one of the things, if you're a highly trained endurance athlete, is you can tolerate heat better, even if you haven't done specific heat acclimation. Quite often the athletes I've worked with would be well able to tolerate 40 degrees of core body temperature, because of their fitness enables them to do that, unlike a lower fitness endurance athlete. Age does have a factor here in exertional heat stroke, and there are multiple reasons why younger children, especially pre-pubertal children, would suffer more in the heat, but they have an underdeveloped ability to lose heat from the body. They have a smaller blood volume relative to body size, and a lower sweating rate. So there are several reasons that, if you've got an under 12 group running in a hill race, that they will have reduced capacity to tolerate heat, that even a kind of late teenager would be able to manage. Overweight, which it's probably going to be less likely in elite athletes, but if you have a participation group of different levels of fitness, the overweight athletes are less likely to lose heat, because you've got a reduced skin surface to body volume, which is one of the principles of heat loss. I've put unacclimatized in there. I mean, typically we're going to be unacclimatized in this country. You know, certainly at the start of the summer, you're going to be unacclimatized. Maybe at the end of the summer, when you've been racing for several months and the conditions have been, you know, similar to how they've been here for the last month or so, you will become acclimatized to that. But yeah, if you're unacclimatized, if your first experience of what you might consider relatively mild conditions at the end of the summer, your first experience of them could be your first incidence of heat stroke. Dehydration can compound factors, especially if you're entering a race dehydrated, because a lot of these races aren't really long enough for dehydration to become a factor in itself, unless you're already not following good hydration behaviors during the day or even the day before. Sleep deprivation can come into it as well. And then certain medications such as beta blockers, antihistamines, diuretics can all compound or increase some of these risks of developing heat illness or heat stroke. And the obvious external risk factors are high temperature, high solar load as well. So that's the one that doesn't get factored into things like heat index. High humidity is a huge factor as well. And having no shade. So if you're running up a mountain, you can be quite exposed a lot of the time. And having no shade can be a major factor in your ability to cool down. You can choose inappropriate clothing. So if you choose darker clothes, you're going to heat up more. If you choose a non-wicking fabric, such as cotton, it's not going to draw water vapor away from your skin as well. Or you could simply wear too much. And going too fast for the conditions, inappropriate intensity for the conditions is going to increase your risk factors for developing heat stroke. There's certain predisposing medical conditions that would reduce your ability to lose heat. And a big one across the community, but hopefully presentations such as today will help, is that lack of education amongst everyone participating. So race organizers, coaches, athletes, even first aiders who aren't trained specifically for heat stroke. That can increase the risk for everyone if there isn't the preparation in there. If there isn't an emergency plan specifically defined for heat illness, the way it would be often for if there's a cardiac arrhythmia, there's a defibrillator present. There tends to be greater planning for cardiac events, even though deaths from heat illness can be greater than deaths from cardiac events in young. And a lack of preparation for cooling, for shade, for fluids. Having tents at the start line, even somewhere on the course. Knowing where somebody could get shade and can be cooled. That can increase the risk factors for everyone. And delay in recognizing early warning signs. And that kind of falls into education for athletes and even spectators and coaches and parents, that everyone's watching each other's back and you're aware of the kind of symptoms to look out for. So that kind of cognitive dysfunction where somebody's being unusually aggressive or exhibiting those kind of strange behavioral symptoms, that everyone's aware to watch out, that actually, hang on a minute, this is a red flag. This is a potential heat stroke victim here. So I've mentioned a little bit about heat index, and it is kind of used as a play or stop tool for different sports. So this is an example from the Lawn Tennis Association, and you can see basically across the horizontal axis is temperature, and across the vertical axis is humidity. And amber means the play is modified, and red means that they suspend the play until conditions are more tolerable. Heat index is a measure of how hot it feels, combining air temperature and relative humidity. So it's that perception of temperature. So if you start in the top left corner here, we've got 20 degrees and 50% humidity, perceived temperature is quite low. But as humidity increases and as temperature increases, that perceived temperature increases. And one of the things to point out with these kind of amber red, dark red, which would fall into categorizing heat index as, caution, extreme caution, danger, increasing risk of heat illness. They're based, for example, from the National Weather Service in America on being active in the heat, not necessarily performing a sport in the heat. The intensity that you would compete in when you're running up a mountain or a hill versus actually this is based around working outdoors, being a laborer outdoors, maybe, for a prolonged period of time, but not necessarily the intensity you would go at running. So I wouldn't use the amber red categories here immediately relating it to sport.
Ian, can I just come in there just while you've got that, if you can go back to that slide, and
Yeah.
I'll come on to this when I talk about our experience. So, looking back on the day of the race in Peebles, yeah, there you are. Yeah, 21 degrees and 86, way into the white zone, but we still had issues. Thanks.
No, that was a very serendipitous time to come in, Gregor. So yeah, this wasn't lined up. This was very coincidental. Gregor came in, but the point here is because Gregor was so kind to share the kind of referee's report and risk assessment from their event, is that if you were to use heat index and look at the conditions, 21 degrees, 86% humidity, well, there's no risk here. There's no risk at all. It's perceived temperature 21 degrees. What's the problem? Let's just crack on with it. But yet there's 5 athletes treated for heat illness, which, as the scientist in me would tell me, well, that's a problem with your measure. Your measure is telling you something wrong. And if you've got an incorrect measure, an inaccurate measure, maybe you need to revisit how you judge conditions. And one of the points to make with heat index is that it was developed based on shady light wind conditions, so it does not take into account solar radiation. And that first statement there, if you're exposed to direct sunlight, you can add 8 degrees to heat index value. That's from the American Weather Service. It's that's a rule of thumb. It's not, it's not a scientifically validated way of saying, right, we could just add 8 to heat index and that accounts for the sun. Other researchers have said a black globe temperature, which I'll go on to in a second, you can be 10 to 15 degrees higher. So this is black globe measuring solar radiation versus what your ambient temperature is in the middle of a clear summer day. So solar radiation massively increases the heat load that's going to be on an athlete, and using heat index isn't going to take that into account. So I said you can't add 8 degrees validly, but I'm going to do it anyway, just to illustrate what would happen if we added 8 degrees to heat index across the entire matrix there. You can see all of a sudden Gregor's race, 21 degrees, 86% humidity is now perceived temperature of 29 degrees. So this is just an illustration. It's not necessarily a linear relationship where we add 8 degrees and that gives us an accurate representation, but it shows you that actually potentially when you factor in solar radiation, you're pushing 30 degrees, even though it seems quite warm. And that would fit in with the kind of narrative feedback that Gregor, you received from athletes who were saying, yeah, it was quite hot and sticky on the day. Other research has shown that when you add in solar radiation versus removing it, so this is experimental studies, indoor versus outdoors, you can add 8 to 10 BPM per minute in terms of heart rate. So it has a significant effect on increasing your metabolism and your generation of heat as well. So what alternatives are there? Well, wet bulb globe temperature is more comprehensive because it takes into account your air temperature, your humidity, which is your wet bulb, and the black globe is your solar or radiant heat. And I've a couple of pictures of the types of technology you would have. You would measure it in the field, so you couldn't use it in advance, several days in advance, unless you were on the course measuring it directly. But if you have one of these in the field on the day, you get a better assessment of the conditions. And the table I have there is from it's used in world athletics, but they're using a flagging system: white, green, yellow, red, black, based on wet bulb globe temperature and conditions under whether you proceed, you modify, or you cancel races. But it's not perfect, okay? Because wet bulb globe temperature doesn't work as well under high humidity and if there's low air movement, so the low wind. It doesn't necessarily account for heat production, metabolic heat production. So that's you as an athlete running, you're the main source of heat. well above globe temperature doesn't take this into account. So yeah, it's probably better than heat index, but I wouldn't say it's exactly a gold standard that everyone should run out and buy one of these if they're a race organizer. It's useful, but you would use it under caution, I suppose. So many sports do use the play stop rule. So while it's useful, you might come up with a flagging system like much of these sports have, and World Athletics have theirs in there as well. So they've using well above globe temperature. If you're if you're doing a road race, or even if you're on the track, this is the kind of caution warning, severe warning, danger, and they would have stop, cancel, or modify based off those conditions. The Tokyo Olympics had something similar, and they did this for multiple sports. So you have across the top beach volleyball, there's athletics, triathlon, and at the bottom there's tennis. And just the different conditions based on different time of day resulted in different heat stress ratings, the different weather, different heat stress. And you can see it can be quite low heat stress rating up to quite high. And if you look at the bottom right for tennis, 4 o'clock in the tennis park was the maximum heat stress rating, which was suspension of play, versus the one to the left of it was 4, so still quite high, but they modified, so there's 10 minutes breaks between second and third sets, and changeover time was increased. So there's modifications in play that are probably easier in other sports, especially field sports or sports such as tennis, that you wouldn't necessarily have in running. Other than running, of course, you can reduce the duration of events, but the fundamental one would be reducing the start time. So in terms of cooling, what is the quickest way to cool somebody? And I'll re-emphasize that principle where heat stroke and heat exhaustion is that you're going to cool somebody first, transport second. So understanding what cooling is available and what is the optimal way of cooling is crucial for for race organizers and first aiders. So a little graph there of cooling rate per minute for different modalities of cooling, and far right you have ice water immersion, which is the gold standard for cooling, and far left there you have ice packs applied to major arteries, which is, if you look at the graph, is the cooling rate is much lower. So if I pull out just a few of those examples there, because it might be a little bit tricky to see on the graph. If you take an example of somebody, they hit 41 degrees core temperature, you wanted to reduce them to 39 or just below 39 using ice water immersion, that would take 6 minutes. Cold water immersion, so it doesn't have as much ice in it, a little bit longer. Tarp assisted cooling, which I'm going to cover in a couple of slides, a little bit longer. Even ice packs applied to the whole body, though, you're pushing 27 minutes, so it's quite a long time to cool somebody down if you're not exposing them to full body cooling. And the two principles to factor into cooling are maximizing the surface area of skin that you're covering. So, if they're sitting down in an ice water bath with their neck and head above water, you're doing maximal cooling. If it's in ice water, you're doing the maximum modality. And anything beyond that is, if you're sticking their legs in the water, it's good. You're going to get decent cooling of the legs, but you've got a large part of the body that isn't getting cooling applied to it. And if you haven't got ice water, you just have cold water, again, that's going to reduce the rate of cooling that you can do. It's going to be useful, but it's not going to be optimal. And I get it that you're not going to have hundreds and hundreds of liters of water and hundreds of kilos of ice when you're halfway up a mountain, but it's just to illustrate what is gold standard, and how can you get as close to gold standard as possible. What is pragmatic, and what is second best option or third best option. So this some of the research would suggest exertional heat stroke, you need to immerse for about 11 or 12 minutes. If water temperature is less than 9 degrees, temperature gets warmer, you're pushing to maybe 20 minutes. But that, even that, although that rate of cooling is slower and you're immersing somebody for longer, that's effective for over 90% of patients who have that kind of high rectal temperature that's been confirmed as pushing you towards heat stroke. Some of them will be heat exhaustion, though. So if you're cooling them, if it takes 6 minutes to cool somebody 2 degrees, you obviously don't want to leave them in an ice bath for an hour because you are going to continue to cool them. You will cool them as best possible. You'll be on the phone to 999. You'll hand over to a first aider, or there'll be advanced first aiders on course that will be able to make a decision on when to stop cooling because they can take core temperature. But just something to factor in is that if you cool and cool and cool, you can get that actual hypothermia, just an after drop. So you've cooled them beyond the point where you've got their core body temperature normal. You've overcooled them essentially. So a couple of examples here. The one on the left, I think, is from one of the road races in America, and there's an example of, right, well, you've quite large resources financially. If it's a big race, it's also running on the flat. It's easier to have this kind of cooling tent. So they set up quite large cooling facilities because they would have a history, given their climate and huge participation, of having quite high incidence of heat stroke. If you look at simpler options, you could have inflatable ice baths, so you can easily transport these in a car, several of them in a car, inflate them at the start area. So if you have a shaded tent or shaded space, you could use this as your potential first aid station. But again, you got to factor in that you're going to use a huge volume of ice. So as an example, single ice bath, the suggestion here is using 35 kilos of ice initially, plus more to maintain that temperature. So you will need a lot of ice. Of course, the ice is going to melt if it's warm temperature, so you need somewhere to cool it. So it might not be practical as a cooling method, but having access to cold water is a next best option. So if there's houses next door, you can get somebody's hose in, or if there's a burn nearby, you can fill a bath up and continue to refill it. And one of the fundamentals you do when you're cooling someone is making sure you agitate that water. They're not sitting there in stationary water. You agitate it so the water around them will warm up. So you need to move that water around. So it's constantly cool water and interchanging water that's moving around them. And you add to the water, you add ice to it, you add colder water to it. In terms of cooling in the field, there's lots of options as well. This is a kind of bespoke invention from the Royal Marines, and it's a really nice option. And I'll share these slides with Angela, and there'll be a link to this if anyone looks at it. But that story is a nice short story on news story on how this was developed and how it's used. But basically, it's this kind of large bag that a patient is put into, and water is added in large volumes and is discharged at the bottom. But of course, there's going to be an expense if every single race organizer has to buy at least one of these. But the principle is basically a bag that you can fit a human in. And a bag that you can fit a human in is a body bag, which you can get for about £10, slightly morbid, but it's a much cheaper option of a nice practical bag you can fit a person in. Once you have water or ice, you can add that to the bag, or you can use a tarpaulin. Go to your local DIY store, get a tarpaulin of sufficient size that's going to fit a human in it. Again, you're going to need large volumes of water, and if you've got access to ice, you're going to need a lot of ice. But these are kind of budget options for setting up a cooling station at the start or finish line. So if you get a tarpaulin, there's this method called tarp assisted cooling, and you can see it does what it says in the tin. You've got a bunch of people there holding each side of the tarpaulin. You add a lot of water, you add a lot of ice. You make sure the patient's head is elevated and supported so they're not going underwater, obviously, and you agitate that so the people on the side are basically going to rock and roll it so the water is sloshing around, and you have somebody else add extra water or extra ice as the water tends to warm up. So that's quite a useful method for cooling somebody if you've got enough people, and of course if you got enough water and ice. Alternative to that kind of large volume of water required is this rotating ice wet towels. Simply what you do is, again, you would need a bucket of water and some ice, but you put a towel like a bath towel in the bucket. You take it out and you cover somebody with it, or if you've multiple towels, you put multiple towels on them. And every minute or two, you rotate a new towel in. So you put a towel on the person, you put a new one in the bucket, you change them around, and that's a quite effective way of cooling. And it's something that we've actually used with athletes competing in Tokyo and Paris, where they need to cool in between events, depending on what sport they're in. You say, well, this is quite a good way of you cooling if you're out exposed for an hour or two. And you've got access to ice, then have a towel with you, and it's a good way of cooling people down. Evidence-based consensus is aim to cool until 39 degrees. If you haven't got a advanced first aider there or medical care who can take rectal temperature, you're not going to know. But if somebody's there and they can't take it, you want to cool them at least until they're 39 degrees, and cool them as soon as possible within collapses, which again, go back to that principle, which I've said a few times, is cool first, transport second. And that's going to determine the patient outcome if you can cool them quickly and cool them to 39 or so. And I'm just going to cover off a little bit on hydration before I wrap up. But hydration is important, but it's maybe oversold. And I touched on that at the start with hyponatremia, that if you overhydrate, you have a potential risk of a catastrophic outcome with hyponatremia, where you're effectively diluting the electrolyte content of your cells in the body. So yes, hydration is important, and it's important for maintaining sweat rate, and dehydration can be quite serious, but beware of over drinking. And drinking to thirst is generally considered now to be sufficient, not I would say maybe oversold by drinks companies, where if you're thirsty, you're already dehydrated, or that's probably oversold. But you shouldn't be hydrating to replace all the sweat you've lost. So it is normal enough to lose some body weight when you're exercising. When you burn fat, when you burn carbohydrates, they release water into your bloodstream, so that will hydrate you even though you're losing weight. If you're running a marathon and you're a 205, 210 marathon runner, you'll probably release about 3.5-4 kilos of water. So it's quite substantial. Running in shorter events, of course, it's going to be a lot less, but hydration is important, but really don't overdo it though. And just putting a bit of responsibility on the athlete. And most of this, I would say, is before you even reach the start line. What can you do to reduce your risk of heat illness? So starting on the left there, I'll re-emphasize that if you've had a recent occurring illness, just sit this one out. If you've had a fever, especially, you're going to be at higher risk of heat illness, exertional heat illness if you race. So if you've been sick recently, or you're currently carrying something, a little bug, little cold, just forget about it. Just think, I'll wait a week or two before I race again. I've put this in, consider not racing if previous heat illness. What I mean by that is if you know the conditions are hot and there's an increased risk of illness in advance, and you've had heat illness such as heat stroke before, you've got increased risk of getting heat stroke if you've had a previous severe heat illness. And if heat illness is serious enough, it can be lifelong, that your ability to tolerate heat is reduced. And we have seen that in some athletes who have had a previous heat illness, that they just do not tolerate heat as well. So if you see the conditions are going to be a bit extreme and you've had severe, if you've had heat exhaustion or heat stroke before, I would just say maybe consider not racing. In terms of clothing, you should wear light colored clothes, I think, rather than darker colored clothes. Probably consider wearing a cap. Ideally, a moisture wicking fabric, something that's going to draw moisture away from the body. So polyester or nylon are good examples. Cotton is a poor example. But if you Google it, you'll find there's lots of options out there. Dark tint sunglasses, your eyes can suffer quite bad damage, especially if the sun is bright and uncovered. So dark tint sunglasses can help. Sunscreen, you're talking about the lower severity of heat illness, but higher occurrence, things like sunburn. Sunburn can be quite severe, so aim to wear sunscreen greater than SPF 30. And look at the back of the bottle. If it says non-greasy, I would go with that, or non-oil based, because the kind of more oil-based or greasy sunscreens inhibit your ability to evaporate sweat a little bit. So aim for the non-greasy stuff. And for higher level athletes who know in advance they're going to be competing in hot conditions, for example, if you're going overseas and it's going to be hot, then be remiss of you not to undergo some form of heat acclimation. But that's more if you know well in advance that conditions are going to be hot, and that would be typically if you're going to a different climate. During the race, another thing that's, I'm going to say, like, hydration is maybe oversold a little bit. Warm up is probably oversold a little bit. If it's warm enough, you need to do the minimum amount of a warm up for you to be prepared. If you warm up for an hour in the heat before doing, a 25-minute race, that hour in the heat is going to get your core temperature up before you even start. So you've exposed yourself to quite a lot of heat before even beginning the race. So do the bare minimum that makes you feel ready to race. Think about the things that are the non-essentials that you would happily get rid of. And fundamentally, running slower. So if it's going to be heat, if it's going to be hot conditions, consider, this isn't the day I'm going to PB. This isn't the day I'm going to run my fastest. I'll just adjust it accordingly, because you are the source of heat, and slowing down is what will reduce the heat production. And in terms of hydration, drink little and often. Don't drink large volumes in one go. Don't drink a large volume just at the start. Throughout the day before you start, drink little and often. So make sure you're hydrated going into it, but don't drink I'll knock back 500 mils of water just before I start. And last slide from me, the final words on protecting the athlete. I've pulled this off the IOC, the Olympic Committee consensus statement from 2023. So I guess that was pre-Paris, on their recommendations and regulations for sport events. But they've kind of a nice sort of summary of, starting from collaboration. So the onus isn't just on the race organizers, or isn't just on the National Association, or isn't just on the athlete. It's on everyone to collaborate and say, right, how do we protect the athlete best as a community? Monitor and communicate. So I've gone over the limitations of using heat index, but of course you want to know the weather conditions in advance, and ideally you're measuring something on the day using, for example, wet bulb lobe temperature, to get a better understanding of what the perceived heat is going to be like for the athlete. And providing sufficient ice, shade recovery areas, and having hydration available, which is going to fall on the athlete themselves as well as on race organizers. In terms of preparation, the athlete should manage their health status, so don't race if you've been recently ill. Plan your hydration. Think about your own cooling, what your warm-up is going to be like, minimizing that, what you're wearing, and if you're going to be if you know you're going to be racing in hot conditions, what's your heat acclimation plan, several months out from that race. In terms of training, that's not related to training as an athlete, fitness training. It's training of, are your first aiders specifically trained in managing heat illness, recognizing heat illness? So that rapid recognition, rapid cooling, rapid care, whoever's on course responsible first aid, have they got the adequate training for that? And is the cool first, transport second paradigm being followed? And the last one for me is just on policy. So National Association should ideally have specific environmental heat policies with a clear communication pathway on the level of risk, knowing how you're identifying that level of risk and what are the countermeasures, what plan is in place. Heat illness is a possibility, so what plan have you got in place? And what records are you keeping of any incidents of the heat illness that are going to feed into other race organizers, into your association, into you the following year looking at your records and go, right, we had X incidences, this was the conditions, this is the amount of people went off to hospital, these are the amount of people that were treated on field that went home. And the one thing I would just finally touch on is that if you have suffered a heat illness, but you're cooled sufficiently on site, you should probably have a follow up with your GP or sports medic just to get ticked off on your health and your return to competition. And that is the last one from me. Thanks for listening.
Thank you. That was very interesting and educational. Gregor, would you like to say a word about your experience, please?
Just so everyone's aware, the experiences we had arose at the Junior Home International in 2023, September 2023, which we hosted on Cademere Hill near Peebles. I've been running the Cademere roller coaster hill race on that same hill, same route for 10, 11 years. We'd raced in hotter conditions previously in the roller coaster than we had on the day of the Junior Home International. But it was that Junior Home International, which I think it's fair to say caught us out a bit in regard to the heat stress suffered by 5 athletes. So we had 4 races, 2 under 17 boys and girls, 2 under 20. And Angela, it's not an excessive distance. It's under 17s, if I remember rightly, were 3.8K. The climb was not overly excessive. The older athletes raced round about 6 kilometers with about 220, 230 climb. So not excessive, but open land. It actually wasn't that sunny, and Kane's talked about solar radiation, and you've seen that slide. The weather stats for the day recorded a high of 21 for Peebles, and humidity of 86. So the solar radiation factor, because it was cloudy to begin with, and we were more concerned about the build-up of cloud and the risk of thunder and lightning than we were about the temperature. We had a team managers meeting the evening before, so we had 2 experienced representatives from the hill running community from England, Scotland, Wales, Northern Ireland, and Ireland. And we spoke about the thunder and lightning risk. I think everyone had looked at the weather forecast for the following day. No one out of all these people raised any issues at all about potential heat issues. But as I said, a lot of runners came in looking really hot and bothered, and we had 5 cases that required some sort of treatment from our first aiders. Interesting, at a point, we had a first aider at the finish was very experienced first aider from Tweed Valley Mountain Rescue. But he was very appreciative of the support we got from Angela, but also one of my coaching colleagues here, Ross Grieve, who has done multiple ultra marathons. He's a physio, and it was Ross who helped with the one more serious case that we had. Ross recognised that the lad was recovering. And if I can just look at his notes, and Kane, you can come in on this and correct me if I'm wrong. So Ross referred to he was demonstrating all the signs that his body was doing the right things to establish balance, homeostasis. It's called a negative feedback loop. So you get alternating between feeling too hot, then too cold, then too hot, too cold, but less extreme each time. And that's your body tending towards equilibrium. So Ross recognized that in this lad who was the more serious case. But even our mountain rescue first aider didn't have that sort of knowledge and wouldn't have recognized those recovery factors. His experience was if the case is bad, it's 999 and get them off to hospital, which again goes against your issue, Cian, of cool first and then transport. So I think a lot to learn.
Yeah, just touching on that one, Greg, I would say the cool first, transport second is get them as soon as possible into ice or ice water and cool them, and then you're immediately onto 999 after that if you suspect heat stroke. So it's not a it's not a sit around and hope for the best. It's right, get them cold, but while we're getting them cold, let's get on to paramedics and tell them we need immediate support.
Yeah. From that event, we immediately flagged with Angela and Anne Buckley at UKA the need for additional guidance. Flagged it also to Ali Love at Scottish Athletics, who referred us to a risk assessment template, which you can find somewhere on Scottish Athletics website. It's not easy to find, but he said he was open to any further advice and guidance, and we've certainly felt that that is necessary. And we subsequently, for the roller coaster, we now refer people to a hyperthermia leaflet, which is on the Fell Runners Association website. We link that from the race information sheet and also refer to it in the athlete declaration on the entry form, asking the athletes who enter all to acknowledge that they are aware of that leaflet. So we're getting some education and information hopefully out there to the people who enter. But I think there's still a fair bit to be done from the point of view of official guidance to race organisers and to the athletes. And as Cian said, it's more about other runners recognising the symptoms in other runners rather than the runner themselves recognising the symptoms. And that's possibly one of the corrections that you mentioned, Cian, might be helpful in the FRA document. So I think there is more that can be and needs to be done in terms of our own risk assessment and mitigations. I've always had two sweepers in our races, and we make sure that the sweepers and the on-course marshals all carry ice packs. I know, Cian, you said that is the sort of minimal mitigation that we can do, but being out in the hill, no vehicle access, that's really all that we can do. We can't have ice baths out on the hill or expect the marshals out in the hill to be carrying loads and loads of water out there. It's just difficult access. So ice packs at the finish as well. One interesting point, in terms of treating these athletes, we have a gazebo, a club gazebo near the finish area, with the intention that if anyone does need first aid treatment, then you can do so with some privacy. On that day and on other race days, it has been absolutely boiling in that gazebo. So it defeats the purpose. If you're trying to get somebody in the shade to help with the cooling of the athlete, then sticking them in a gazebo is not going to work. So we ended up with the lad who was more serious, just taking him to the side of the gazebo, trying to get some privacy round the back of the gazebo, but not actually in the gazebo itself. We've also been lucky enough that I personally know uh, somebody who's a landlord of one of the houses not too far from the finish, and we have been able to get a garden hose put over his wall. We've had it available on a couple of occasions when it's been hot, and that's something that we will probably do as a matter of course. Obviously, not everyone else is going to be able to have that potential solution to cooling, but as long as they let the water run, if the hose has been sitting out for an hour or two in hot sun, then you've obviously got to let it run for a while before you're getting any cool water coming through. But that has certainly worked in the past in terms of cooling athletes down, although we didn't have it on the occasion of the Junior Home International. And looking back on that, that's something that we should have done and will do in future. I think that's most of the points that I wanted to bring up. The age group thing, Cian's, I know there's no set age at which your heat control mechanisms will be fully developed, but that is something that arose from our experience at the Junior Home International as well, that junior athletes, and particularly in a race like that where they're representing their country, they're going to dig in, they're going to give their absolute all when they're in an international race. But the fact that their heat control mechanisms are not fully developed is another factor that means, as race organisers, particularly for junior races, you really have to consider whether it's safe to go ahead. If it is safe to go ahead, are you reducing the distance and therefore reducing the exertion? So lots of things that we've taken on board from our experience, and looking back, we were probably lucky that the more serious case that we had, the lad was on the road to recovery. So yeah, happy to take any questions.
That's where I'll come in. Has anybody got any questions for Gregor or Kane? Okay, I think we can wrap that up. And I'm sure if you have any further questions, are you happy if we pass them on?
Absolutely, yeah.
Yeah. And it's just finally for me to say a big thank you. I think everybody appreciated this, and there's a lot of thank you coming in on the chat there. Okay.
Yeah, you're very welcome, and thanks for the invite, Angela.
Yeah, thank you. Thanks a lot. Bye.
Right.
Bye.
Cheerio.